Docusol 283 mg Enema Laxatives are used to treat occasional constipation. It contains docusate, which is a stool softener that increases the amount of water the stool absorbs in the gut, making it softer and easier to pass. This product typically results in a bowel movement within 2 to 15 minutes. Be sure to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Using the wrong product could harm you. It is best to take this laxative as directed by your healthcare professional, and it is important to follow the recommended daily dosage. The optimal timing for taking Docusol 283 mg Enema Laxatives may vary, so consult with your healthcare professional for the best time to take this medication. When using Docusol 283 mg Enema Laxatives, it's important to remember that this product is for rectal use only. If you are using the over-the-counter product to self-treat, make sure to read and follow all directions on the product package before using this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before and after using this product, remember to wash your hands. Twist and remove the tip, then lubricate the tip of the bottle and the rectum with lubricant or the liquid before inserting. Lie on your left side with knee bent or kneel with your head and chest forward until the left side of the face is resting on a surface with your left arm folded comfortably. Alternatively, you may also administer it while seated on the toilet. With steady pressure, gently insert enema tip into the rectum up to the shoulder of the tube with a slight side-to-side movement, pointing the tip toward the navel. Do not force the enema tip into the rectum because doing so can cause injury. Squeeze the tube until nearly all of the liquid is inside the rectum. A small amount of liquid may remain in the tube after use. Remove the single-use tube from the rectum and discard it properly. Remember to use this medication only when needed and do not use it for more than 1 week unless directed by your doctor. The dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you experience rectal irritation, burning, or itching while using Docusol 283 mg Enema Laxatives, it's important to talk to your doctor or pharmacist. Keep in mind that your doctor has determined that the benefits of using this medication outweigh the potential side effects for you. Most people using this medication do not experience serious side effects. However, you should seek immediate medical attention if you have any serious side effects, such as rectal bleeding or signs of a serious allergic reaction, like rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. As always, it's important to follow your doctor's instructions and reach out for medical advice if you have any concerns. Before using Docusol 283 mg Enema Laxatives, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to any inactive ingredients in the product. If you have any health problems such as rectal bleeding, severe abdominal pain, nausea, vomiting, or a sudden change in bowel habits over the previous 2 weeks, it's important to consult your doctor or pharmacist before using this medication. If you are pregnant or planning to breastfeed, be sure to talk to your doctor before using Docusol 283 mg Enema Laxatives. And before having surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to be aware of potential drug interactions with Docusol 283 mg Enema Laxatives, as they can impact how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Docusol 283 mg Enema Laxatives is mineral oil. Be sure to discuss any concerns about drug interactions with your healthcare provider. As always, it's important to follow your doctor's guidance for the best results. If this medication is swallowed, it can be harmful. If an overdose occurs and serious symptoms like passing out or difficulty breathing are present, it is important to seek medical attention immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. Residents of Canada can call a provincial poison control center for assistance. Be sure to attend all scheduled medical appointments and lab visits. In order to avoid constipation, it's important to consume enough dietary fiber, stay hydrated, and engage in regular physical activity. Docusol 283 mg Enema Laxatives should only be used for short-term relief of constipation. It's important to avoid prolonged use in order to prevent dependency on laxatives. Docusol 283 mg Enema Laxatives is used to treat occasional constipation. It works by softening the stool to make it easier to pass. This medication is for rectal use only. Follow all directions on the product package, or use as directed by your doctor. The usual dosage is 1 enema as needed, or as directed by your doctor. The best time to use this medication is in the evening, or as directed by your doctor. Make sure to check the storage information on the package and keep this medication out of reach of children and pets. Do not flush this medication down the toilet or pour it down the drain unless directed to do so. When this product is expired or no longer needed, be sure to dispose of it properly. It's best to consult your pharmacist or local waste disposal company for guidance on the correct disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.